Next question is number 636. So if you have number 636, and then
Go right there.
734, 734, and then 457. If you have 457.
Seven, that's something to say.
I've been waiting for this.
Well, I'm glad I don't have to follow him.
No, go ahead.
Congressman Labrador, I would love to follow up on your incredible climate change denial, but I think it's hopeless.
I didn't deny it. I just don't want to tax everybody for it like you do.
Well, you're denying the science of it.
No, I'm not.
You're talking about 30-year cycles, and we're seeing...
Which is what the science says.
That's not what the polar regions are saying.
Well, actually, the Arctic has seen more ice.
Oh, I saw that story yesterday.
Actually, it is seeing more ice than it has seen before.
Anyway, I'm going to move on to public lands.
Please.
Our public lands, including our national parks, wilderness areas, monuments, and national forests, are precious places owned by all of the American people. They are places most of us can afford to visit and share in the natural beauty that is preserved for future generations, providing clean air, water, and habitat for our wildlife. Why do you and other members of your party favor stealing these lands away from Americans and turning them over to states where they could be sold off and face environmental degradation from resource extraction? Do you see no value in preserving these lands for our kids and our grandchildren?
Your statement was incorrect. I do not favor giving the states the lands. I like public lands. I think we need more access to public lands, but I also think we need to use the natural resources on our public lands. So what I favor, just so you understand, what I favor is having the state manage the federal public lands under state management practices. We manage our state lands very well at the state level, and I think we can do a better job on the federal lands. Our state lands are actually healthier and more vibrant than our federal lands, and I have a bill that does exactly that, but I have never favored the transfer of public lands from the federal to the state.
I guess I have trouble making the distinction between transferring the lands and transferring management.
The big distinction is that when you don't own the land, you can't sell it, and your biggest concern is, are we going to sell the land? You can't sell the land if you don't own it. That's the big difference. You can use it, which is why God gave it to us, is so we can actually use our lands. Yes, sir.
Okay, this
You use
question,
the microphone so they can hear you.
okay. This question is really about fairness. And let's go back to 70% of your medical is paid for, subsidized. Is that correct?
I believe that's about the right number, yes.
You are talking to people that don't have that benefit. Yes?
You can get my job, and you will have the same benefits.
So, in
You
other
can-
words, by being a congressman,
No.
you have privilege.
No, before I was a member of Congress, I paid for my own health
Hey,
care.
that's the
I had a business.
That's false equivalency.
No,
You now are a congressman and are taking advantage of it because you can write your own rule.
No, I
Now,
can't.
let's
No,
move on.
wait.
Let's move on to something
No,
else.
we're not going to move on.
Okay.
I have received the same benefits as every federal employee. My benefits are no different than any other.
So?
Well, you're saying I have privilege. I don't have privilege.
Wait.
I receive the same federal benefits that any other.
10,000 people that are running the government, pick a number, have written the rules for themselves, and you think that's fine. You're joining it, and you're defending it. Right?
I'm not sure what your point is. Can you
The
move on to your
point
next question?
The point is that you have the privilege that is written into having 70% of your medical costs subsidized. And that's only the beginning. You have access to a doctor at just about on call.
That's not true.
You want me to pull it up
I
for
pay
you?
for that if I want to have access to it. I should pay out of my pocket to have access to
Okay.
that doctor.
Let's stay with
So
the
that's
second.
not true.
So you're not
So that's the
denying-
second untruth that you have told. Can you keep going?
Really? The
Yes.
70% is not true?
No, that I do something that nobody else does. I receive same benefits that all the federal employees receive.
Hey, I'm
And we can change that. I think if that's your point, that we should change the benefits, to federal employees, we could do that.
And the chances of that are 0. Okay, let's
They haven't changed
let's
things.
try another fair question.
Yeah.
How do you feel about the morality of in the last 30, 40 years that the rich are getting richer and the poor are getting poorer? Does that really serve democracy?
So it is a concern when the rich get richer and the poor get poorer. I have a different sort of opinion on how that happens. That happens through the growth of government. That happens through the government getting bigger, and you have the people that have money have access to lobbyists, to people in Washington, D.C. They hire lobbyists to make laws that benefit them at the expense of everybody else.
Being a lobbyist is your next job, isn't it?
No. I know that's what the Lewiston Tribune wants to say, but, you know, like, they lie about everything.
We'll
else.
see where you go.
So the reality is that I want less access to lobbyists. I want government to be more for the people. I have done it when I was in Washington, D.C. You can ask Dr. Rushi if you want. Lobbyists don't like me very much because I say no to lobbyists. Is that true? They don't like me very much because I tell them no all the time because they come into my office asking for special privileges
Not the
and I
question.
say no.
You're off the question.
I'm not off the
The
question.
question is how do you feel about the disparity of wealth?
I think that is the problem, but I also think we have the richest country in the world, and we have people that have an opportunity in this country, more than in any other country, to get out of poverty and make it into wealth.
And that's why 1% of the people have 90% of the wealth.
That's
And
why,
not
that's
true.
why you don't see too many Americans going to Venezuela or moving to Canada.
Is-
I mean, we got a bunch of Canadians.
You're denying the fact that 1% of this population, this country, has 90% of wealth?
No, I'm not denying, I don't know the percentages, but it's better to be an American and to live in America than any other country. Because America is the greatest country in the world, and you are not moving to Venezuela, are you? You're not moving to Canada, you're staying in America because there's no better country
You're
than
starting to
Venezuela.
look a lot like the oligarchy, though.
Oh, yeah, exactly right.
Yeah, I'm sorry.
Let's
Exactly.
move on to the next question. Number 753. If you have 753. Number 463. 463, in case you, right there, I think. And then 749. You have 749.
Hi, just before the hecklers start, my husband and I are both in healthcare. We both put ourselves through college. We both never worked less than 2 jobs. We pay for our employer-sponsored healthcare. We're not on public assistance. We're not communists. And I do believe America is probably the best place in the world to live because we can have this dialogue. But I also feel that at this moment, you need to answer things better for us than you're willing to do and stay on task. So I have a healthcare question that's economic. I want you to explain to the taxpayers in this room how we are going to pay for the $20 million in increased indigent care costs when we cut $800 billion out of Medicaid that you voted to yesterday in a direct upward transfer of wealth and tax cuts for the wealthiest Americans. Because everybody on Medicaid in Idaho, which is 18% of our population, not to mention the 83,000 Idahoans that need federal assistance to bargain and purchase their private health insurance, are still going to get sick. And when they get sick, they're going to get sicker because they want a primary care, they want a preventative care, and they're going to lose their jobs, they're going to lose their homes, and then they're going to end up in a $10,000 ICU stay for what could have been a $35 primary care visit and $5 worth of penicillin for their antibiotics. It's going to happen. You're playing a political shell game where you appease the people that you want to appease by saying, look, we're saving all this money and we're not going to let scumbags milk Medicaid. We're going to cut Medicaid. We're going to pay for those people regardless. Do you want to pay for them to take up ICU and ER space at thousands more dollars than it would cost for people to have preventative care? We will not turn people away from ERs when they are dying.
We don't.
We don't.
Yeah.
We're paying for the health care regardless. So why wouldn't we pay for wellness benefits, primary care benefits, and to make sure that we are taking care of the most vulnerable, which happen to be the very most expensive patients to take care of. Instead, we cut $800 billion off of Medicaid that's going to a direct tax cut for the wealthiest Americans, and now we're going to be paying through the nose. So when we talk about healthcare costs being out of control, it's because people like me that have worked and stayed insured regardless of circumstance have to pay exorbitant costs to cover the indigent costs because now Medicaid dollars won't be flowing in. On top of that, with the majority of the state being rural, how is our economy going to absorb $20 million more in indigent costs, $800 billion across the country and drop Medicaid funds when the critical access hospitals will go away, which means our small economies will dissolve?
So let me ask you a question. We're reforming Medicaid to let the states actually do the reforms that are necessary to reduce the cost of health care. We're making it easier for the states to do the things that are necessary. If you look at Oregon, for example, they actually went ahead and increased their Medicaid. They took the money from the federal government, and what they found is that they didn't reduce the cost in indigent care and other things. In fact, their costs went up because most of the poor people ended up going to the ERs anyway. So they increased the amount of money that they were paying on the indigent, and they actually had to increase the amount of money that they were paying on the indigent. There's a report out there. It showed it it's not a Republican report. It was actually a bipartisan group that came out and said that Oregon failed in their experiment by increasing Medicaid because Medicaid and Medicare are not providing the best health care and the best ability for people to use their health care. What we want is the states to have the ability to implement changes to their healthcare system and their healthcare delivery system. And I think we can do it better. We can provide better access, and you will see reductions in the cost of healthcare.
I'd like to hear specifically how you're going to do that instead of saying things like better access. If you do not have insurance, you cannot get primary care in most communities.
So I have told you specifically. You just don't like my answer. But I have told you I have told you specifically. What we do is we reduce.
I'm a Medicaid patient. Now my Medicaid is gone. I need to go to a doctor, and nobody within 100 miles of me will accept a patient that cannot pay cash up front for their services or that is on Medicaid. Explain to me what my access is.
So most
to go to the ER?
So Medicaid, people are actually, doctors are refusing Medicaid patients right now under Obamacare.
Doctors were refusing Medicaid
Right
patients
now.
long before Obamacare
But
because the
they are.
government payment rate is so low. they
Okay,
can't
so
continue
even
to
under
practice.
Obamacare, doctors are refusing Medicaid. So don't try to blame Republicans.
I'm not trying to blame
because-
Republicans. I'm
because-
saying that the problem is if you take away health care, people cannot go to the doctor and they die.
So what the state will do is they will reduce the cost of health insurance for that 97%. And
If
we'll
you
use
don't
that
have
money.
any money to buy
And
health
you please
insurance,
listen.
it doesn't matter.
And the 7% that don't have that insurance, then the state is going to have $130 billion that's going to be divided among all the states to provide access for those people. We are going to help more people than Obamacare helps right now.
This is
Because-
not a plan. You're saying, well, $130 billion. What are you going to provide for people?
The states are going to have to decide how to do that.
How is Idaho going to do that?
We
In the
need to
meantime,
say-
we're going to have $20 million more in costs that everyone in this room needs to cover.
But what you're
How are you
saying,
going
what
to
you're
do it?
saying, Oregon, it didn't work in Oregon. What you're claiming is going to happen here, already happened in Oregon under Obamacare. By increasing the cost of Medicaid, Oregon actually solved more expenses out of their coffers. So it cost them more to have Medicaid patients, and it cost them more in healthcare delivery. So
Where's the $20 million going to come from that it's going to cost us on top of what we're already paying? These are the people that will pay that. Please
we're going to
explain.
reduce the cost for everybody.
How? How?
I just explained it to
You
you.
did not explain it. Are you going to make regions reduce their rates? Are you going to mandate that regions reduce their rates?
I don't mandate anything to agents.
You are mandating people on Medicaid except dying. You are making a mandate.
No
that will
one
kill
wants
people.
anybody to die. You know, that line is so indefensible. Nobody dies because they don't have access to health care.
If you have ever been in an ER at 3 in the morning explaining to a parent that their 2-year-old has leukemia, and the first thing they ask is, will she live? And the second thing they ask is, how can we pay for this? We don't have insurance. It absolutely kills people. You don't know what you're talking about. And you should sit in ER waiting rooms and explain to people that are going to die because they cannot afford insurance. You should sit in the ER and explain to people that their children are going to die because they can't afford the
Unfortunately, you're
insurance.
lying to all these people.
I'm not. I'm a 14-year emergency room nurse, and I have been in that conversation thousands of times. Economics, trade,
What about Jessica
That's it.
Chilcott's?
The ER cannot turn anybody down. It's
I know
against
the
the
ER is
law.
not turning anything down. You can absolutely be turned down to go get cancer treatment when your insurance won't cover it and you cannot pay up front. We saw everybody that walked through the door in the ER. What happens after the ER is the problem, and that is where you are failing us. You are failing people. I hope that your plan to build the wall is out of corpses, because
I didn't, what?
the only feasible economic plan you have is to build the border wall out of corpses of people you have denied health care to.